Good afternoon, Sierra Vista and surrounding community. This is Melanie Edwards-Barton, CEO at the Sierra Vista Area Chamber. And as you can tell, we are not at the Sierra Vista Area Chamber today. We are at Canyon Vista Medical Center, and we have a group of C's here, and we have some exciting information. So, Dr. Phillips, tell us.
Thank you so much. Yes, today we're going to be talking about our recently released CMS Star Rating. And before we get into that, I kind of want to introduce the team here. So we have William Kiefer, our Chief Operating Officer, Cosette Britton, our Chief Nursing Officer, Lynn Carrington, our Chief Financial Officer, and Sunny Burrell from our Human Resources Department.
Wonderful. Well, we have, like I said, some exciting news today to talk about here at Canyon Vista Medical Center. So we've got a list of questions. We're going to kind of do a round robin here, but we're going to start with Lynn. First question. So can you give a little history on Canyon Vista Medical Center for us?
Absolutely. So the hospital has been providing care in Cochise County for about 59 years now. And in the current location, we've been here since 2015. So we've been here for about 8 years. And we originally opened as a Western Osteopathic Hospital, and then through a series of conversions became Canyon Vista Medical Center here locally. And just to give you an idea of the scope and the size of the hospital, on an annual basis, we have about 145,000 patient touches, is what I call it. And these are patients coming to us seeking care. And if you look at the areas where they touch the most, in our medical group, we have about 50,000 patient touches. In our ER, 30,000 patient touches, and then outpatient visits. This is for lab, radiology, and for therapies, about 55,000 patient touches. Annually, we admit about 4,000 to 5,000 patients here. And as far as employees, we have about 800 caregivers. This is both full-time and part-time and contract. To the community, we provide about $65 million in salaries, wages, and benefits. And if you look at our taxes, we pay about $1.3 million in property taxes, and then state assessments that we pay back to the state of Arizona. It's about $8 million.
Wow.
Yep.
So. Wow. And I was just looking at the touches that you were talking about, 145,000. And just in the Sierra Vista area, basically, we have about half the population of Cochise County. So we have about 76,000 people. So that's basically everybody twice a year. That's a lot. That's a lot. So and 800 staff.
Correct. Yep.
Goodness. Caregivers. That's a lot. Wow. And a long history.
Yes, a very long history. And the community has been a great partner to the hospitals. So.
Well.
Yep.
The hospital's been a great partner to the community, so we love that. So Cosette, let's talk a little bit about Canyon Vista Medical Center's ratings throughout the history. And I know this has been an ongoing topic that the Chamber's been talking with Canyon Vista about for years now. And so tell us a little bit about the rating system.
Perfect. So CMS, Centers for Medicare and Medicaid Services, has a Medicare Compare program. So more or less, they get data from your build. So they look at claims, more or less, not what we tell them, but just data that's extracted out of your medical record or your bills to get data about how well a hospital performs. And so pretty much, unless you're a critical access hospital, you offer Medicare benefits to patients. And so the far majority, high 90 percentile, participates in the CMS program. And so they equate that care in the 5 categories to stars, more or less. And so just 5 years ago, we were a 1-star. Mm-hmm. And then we went up to a 2-star and then jumped to 3. We're excited now, we're a 4-star. And so what that is, that all entails, they look at 5 different categories. That's timely and effective care, safety of care, the mortality, how the deaths are happening in your hospital system, readmissions, so how many people are discharged and then come back to the hospital, and then our patient experience, so the scores that are driven off of the patient experience. And so, it's a lot of work that goes into moving that needle over that time, but we're excited. Our 4-star just was released.
So that's incredibly exciting, especially since it's not 10-star rating, right?
Yeah, right.
It's 4 out of 5, correct?
That's right.
Yes.
Absolutely.
So that's a big deal. I think 4 stars. How hard is it to achieve a 4-star rating?
It has taken, well, obviously we had this tiny little thing called COVID occur during all of this, right? For 2.5 years, we've been doing care differently.
Right.
We had to. So but despite that, we have been on this journey, constantly kind of ticking away at every process improvement opportunity in the building, our patient experiences, all of the categories. We look at those metrics in order to just make small changes, small changes sustained over time to really equate to that higher star rating.
Mm-hmm. Wonderful. So I know, or when we're looking at education, things like that. Education, we always go, oh, well, is the school accredited? Do we know what that means? Not necessarily,
right?
But we know that
That's
they're
true.
set to a higher standard and that they've achieved a higher standard. And it's the same with these ratings for the hospitals, correct?
It is. That's absolutely true. There's a lot of comparability there in that analogy. I think that we all want to drive quality off of numbers, right? We don't want to guess, we think we're doing better. So it is really nice to be able to get that data every year, reported back to us. We share it with our teams because that's really where all the hard work comes from, is our teams, the care our providers and our staff are giving on a daily basis. And you just make small changes so it's not shocking to anybody, right? You can't go in and say, I'm going to be a 5-star next year and I was a 1-star, and think that you can put everything in place that's sustainable to do that over a very short amount of time. So it really is, we speak to quality as a journey. We are constantly just kind of on the journey to the best practices, the best care that we can give.
Wonderful. I don't have my glasses on, sorry.
No.
So Sunny, what steps have been taken to reach the 4-star rating through HR specifically?
Yes. So we've had several HR initiatives that we've been working on. The first one was recruitment of more of your permanent workforce, really trying to get a mix of new staff, like new grads, for example, RNs, as well as experienced RNs, and getting that good mix, but also not staffing our entire hospital with travelers. And that's been a difficulty for healthcare in general, where they staffing it's a pretty large number that have left healthcare because of the pandemic. So really trying to retain the staff we have. We have some great caregivers here that we focused on retention, reward, recognition, restructure, creating what we call career pathways, so that I can go from maybe a CNA to an LPN to an RN extern to a new grad and to an experienced RN. So creating that pathway, and maybe even an NP. So we're doing a lot of work around structure of our wage scales, tuition reimbursement, and how we get our people developed and trained, and how we retain them. And I think that we've put in a lot of really great initiatives in the last year. Our vacancy is down. Our vacancy rate is down significantly. Our turnover rate has come down. So we're making a lot of really good progress, and that contributes on the backside to the quality that you see in the 4-star.
Absolutely. You want the employees to come and stay.
Yeah. Right. And we want to be a place of choice. We want people to want to work here. And when I'm a new RN or a new tech, I want people to say, I want to go to Canyon Vista.
Well, and work there. Absolutely. Yeah. So I believe you have a few openings right now. So I just want to throw that out there, that obviously a few openings, and if you want to work at a 4-star hospital, you want to work here.
Yes.
So go on their website.
Yes. Absolutely.
I just have to throw that out there because, this is the opportunity. They've worked obviously on these career fields for the employees and giving them a wonderful place to work. And so, if you have a choice, and you do, make the right one. So moving on, we talk a little bit more here. So we're going to talk with William and Cosette. Do you plan on achieving a 5-star rating? And how would you go about doing that?
We absolutely do. It's obviously part of the goal. So we as Cosette mentioned, just 5 years ago, we were a 1-star, and then progressed to 2 and 3, and then very big celebration when we hit 4, which we're yet to have with our staff, who really, they've done the work of putting the patient first and making sure that those hundreds of thousands or tens of thousands of touch points that we have with patients, they're all positive, which is challenging in healthcare. We all know that people come to us when they're having a bad day, and it's up to us to make sure that they get great care, but they also feel that we are caring and compassionate as we go about doing that, even when there are extended stays in our emergency department, because there are maybe people who are more sick that we're having to take care of before them. So those are all challenging situations that our staff work through on a daily basis. But obviously the 4-star rating shows that we're doing that better than about 80% of the others. And so we're very excited about that. So one of the things that's important to us is our mission and our values. So we're a LifePoint facility, and the mission of LifePoint is to make communities healthier. And that's what we're all about. In fact, I know that we're going to be participating in a fair this weekend.
Yes.
We're going to talk a little bit more about that, but that's part of how we are engaged in the community. And we want to make sure that we're a partner to the community, and that we're out and about outside of the 4 walls of our organization, and that we are meeting the needs of individuals, not only within our 4 walls, but also in the community setting. So we're excited about that. And as we engage more and more with those activities, we feel that we are making Sierra Vista and the surrounding area healthier. And that is our mission. And then to put a little bit more legs on that, we have 5 principles that help us to do that. And so the first is we want to be champions of patient care. We want all of our folks to do that. And we're going to move forward with some of those initiatives. We want our people to do the right thing, and it doesn't have to come to one of us. They're going to do the right thing because they're empowered to do so. And so those are some of the things that we're working with our staff to get them out and to make sure that they're doing on the front lines. And we as leadership will support them as we do those things. So those are some of the things that we're working on to make sure that we are moving in the right direction, and that we're going to maintain this 4-star rating and then achieve a 5-star. And then I think one of the important things, and I'll kick it over to Cosette, that she's going to help us do is round better on our patients.
Yes.
And what
thank you.
does that mean?
Exactly. So 2 initiatives actually related to patient experience. So we want our patients, like William said, to feel satisfied that they're getting quality care and really be able to know that, but also compassionate caregivers that we're patient with them, that we're understanding. It's not every day you're in the hospital, right? It's every day for us. We're here every day. They're not here every day. So we have to be very cognizant of that. And so one of the tactics that we use is called leader rounding. And so us on the executive team, plus all of our directors, managers, coordinators, they round on patients every day. And so it's a really big initiative because everybody gets busy, right? And you don't prioritize how important the leader rounding is. But our patients will see us and our teams coming in and asking them how their stay is. And anybody notable that we can take away to give kudos to, or is there an experience that we can help rectify? Are there challenges? Are you getting updates like you need to? Do you understand your instructions when you go home? All sorts of things like that. So we have a script that we follow, but we ask all those sorts of questions that really is going to elevate the patient experience. And then the other thing that we do related to that is the bedside shift report. So our patients should expect to see caregivers handing off their care with 2 clinicians at bedside. So if William and I are your nurse, he's the night nurse, I'm the day nurse, we're going to hand off, I'm going to give you report with the patient present and a part of the conversation. They're going to remember something that's important that we don't maybe, or that they find a lot of value in. Hey, remember my daughter lives out of state. I can't make it home by myself. I'm going to need some additional support, something like that. So it'll be really important for us to really hardwire that process. We're doing it, but there's opportunity within how often and the content that we're sharing, how inclusive we're being to the patient. So all of those sorts of things are going to be really important as we go forward to get to that 5-star. And then the final thing I'd like to add about that is just the work on culture that we've had to do at our organization. I think in any organization right now, hospitals, healthcare in general, in I'd like to say post-COVID environment, even though we still see a little bit of it, how do we get back to whatever our new normal is, and take the culture and build it up. If our staff are not engaged, and our caregivers and our doctors, and we're not an engaged team culturally, then our patient experience and all the other metrics won't kind of follow. So it's really important work that we're doing related to that stuff too. So,
And if I could add back on, so we just, in July, we had what's called a COSI survey for our facility, and all of the LifePoint facilities throughout the nation had the same survey. And we had a 9-point uptick from the prior year, even through some of the very significant challenges that we had with COVID. And so it shows that our patients are much more engaged, and they're 9 points higher. And we had about 20% more of them that took the survey.
Participation, yeah.
And so it shows that the culture is moving in the right direction at Canyon Vista. And so I think that really shows, you start with internal culture. And one of our jobs as administrators is to put our employees first. And we feel that when you put your employees first, then they put their patients first. And so I think that's shown in the star rating and the progress that's being made across the board.
Absolutely. Thank you. So, Sean, how rare is a 4-star rating? Because I mean, we don't know, as your typical patient consumer out there, we don't pay attention to that. Although we do that on Google. We do that constantly on Google for everything. We'll do that for a pair of shoes, but oddly enough, we won't do that necessarily for a hospital. And so I think it's really important for our viewers out there to understand, if it's rare, how rare is that?
It is rare. And the CMS Star Rating, this isn't something you can buy. This isn't something that you can earn by putting up billboards or newspaper ads. This is something that's really earned at the staff level. It is earned by our EVS workers, our cafeteria, by, of course, our nurses, physicians, and other health professionals. Healthcare is a team sport, and this type of rating, this type of score is earned by the entire team. It's not earned in this room. It's earned out there taking care of patients each and every day. And getting that type of increase, that cultural change and that staff engagement, that's what leads to a 4-star rating. And that's what's going to take us to a 5-star rating too. So, there's over a dozen hospitals here in our corner of Southeast Arizona. And out of those hospitals, there's only 2 with 4-star ratings, and there's 0 5-star hospitals right now in Southeast Arizona. You can go on the CMS website. They have a hospital compare chart. You can go look and see who the other 4-star is. It's probably not who you think it is, honestly. So, but go ahead, take a look at the data, and that data is real. You cannot fake your readmission rate. You can't screw around.
Well, you're not self-assessing.
We are not self-assessing.
You are not self-assessing.
We are not paying a rating agency. This is from the government based on claims data that's submitted. And we're very proud of our 4-star because, again, we are in the very narrow tier of organizations that have gotten to a 4-star. We're going to continue this journey. We're going to continue to a 5-star with everyone in this room and all 800 associates that work with us to get there. And we're really proud that we are, one of only 2 out of all the hospitals here in Southeast Arizona to earn it.
That's fabulous. Wow. So, and it's a journey.
It is. And, the journey from our 1-star, which we were, up to the 3-star, which a 3-star means you're at least as good as the national average hospital. But now we're a 4-star. So we can, rest assured that we provide better care than the majority of hospitals in the United States for the care we offer. There's some things we can't do. I don't have an open heart surgery program. I'm never going to do a liver transplant. There are things that you need to leave this community to do, but I firmly believe that the best care is care close to home in a really high quality facility. And we have that here, and we can provide great care close to your friends, your family, your church, your fellow churchgoers, that community, that support structure that you rely on for life. We want you to be able to rely on that at a hospital as well, close to home.
That's fabulous. 4-star rating. So, Cassette, what does that mean to residents in Southeastern Arizona when it comes to quality care locally?
So Sean hit on a couple of those points. That means that you don't have to drive up. If it's a service we offer, it's highly likely that we're going to provide a high quality of service to you. And so you're going to have a good outcome. And so those are what those numbers kind of equate to, is that you're going to have safe, high delivery of quality care. And so if it's a service we offer, to his point, there are things we just don't do and that we'll probably never do. Not in our lifetime that we'll see that type of growth, but we do offer some services and we do them really, really well. And so you don't have to drive up that hour and 15 minutes or longer to think that you're getting quality care or higher quality care than what you can get closer to home.
And some of those things that we do here that really you shouldn't travel for. Our orthopedics program is fantastic. So the things we can do with total hip and knee replacement, our hip fracture program, one of the few certified hip fracture programs in the country. It was actually when my phone went off, the joys of doing live streaming. That was one of our orthopedic surgeons calling me. But we just provide outstanding care there, from sports medicine, hips and knees, spine, all that kind of care. Our trauma services, we are the only designated level 3 trauma program. Our general surgery team is really top notch, and we're recruiting another surgeon in as well to help that program grow even more. And of course, we're here to treat your pneumonias, get that appendix taken out, deliver your baby in a safe carrying environment. That's what we do each and every day. And there are some things that we provide that, really take it to the next level. We're really proud to do that. And we're proud of things that we're going to be doing in the near future too.
And so, William, there has been a lot of expansion as far as types of services. Did Sean touch all of those? I know there's a lot.
Yeah. And so not all of them are added as of late, but we have some services that we would like to highlight. And I think that sometimes it's easy in a community this size to forget that we have these services. And we're very fortunate in a community size to have inpatient behavioral health services. And so that's a service that we have up on our 4th floor for individuals who are having an acute event when it comes to their mental health. They can come to a local hospital and they can receive quality inpatient services, which is really fantastic. There are so few communities in the nation that have this, and to be a community our size, to have that level of quality inpatient service is really a value add to this community. And we can take care of all of those acute behavioral health, mental health needs. And so I wanted to highlight that again, because I think that we're all becoming so much more educated as to how our whole being is, not just our physical health, but how is our mental health? What are we doing to take care of that side? And so I think that's really important. Sean did allude to the fact that we have our general surgery program. We have 4 general surgeons. We're in transition of 1 right now who's leaving the community, but we've been able to recruit, which again is a testament to the community and how the community fares against every other community in the United States, because it is a hard environment to recruit professionals in today. And I think that we've alluded to this before, is all professionals from nursing to surgical techs to physicians, it is very hard to find these qualified candidates today. It was before COVID, and it's even more difficult today because so many folks have decided that healthcare just wasn't for them for whatever reason, because it was such a challenging time. But we were able to successfully recruit a new general surgeon. His name is Dr. Thompson. He'll be starting with us about mid-October. So we're super excited about that. And he'll bring a great skill set and expertise and experience with him to this community. And so we're excited about that. Another service that we have that I don't think that maybe the community is well aware of is we do interventional radiology here. We'll pause for a moment.
Trauma level green to ED triage 2. Trauma level green to ED triage 2.
And so that was one of our trauma alerts being called overhead. And when you, again, building off of what was said earlier, this organization saves lives each and every day, whether it be through our trauma care, our stroke care, our heart attack care. That happens day in and day out in this facility. And so we're proud to be delivering that level of care in this community. But going back, we were talking about interventional radiology. And that's a service that I don't think that everyone is well aware of. And so if someone needs a biopsy, we can do that for you here. If you need to have a port placed because you need long-term antibiotic therapy, or if you need chemotherapy, we can do that for you here. And there are many other interventional radiology services that we offer here that you don't have to travel to Tucson for. And we need to make the community aware of those services. Something else that we're doing is we also have a urologist here, Dr. Nimchek, and he does a great job. He is extremely busy, but we want to make sure that the community knows that for all your urological needs, those are subspecialties that most communities this size don't have access to, and we're proud to be delivering those services.
Well, it's nice to hear that. We get in the habit. Habits. Habit is, oh, well, I need that. I got to go to Tucson, or I've got to go to Phoenix, without checking to make sure, can I get that here? And if you can get it here, why not?
Absolutely.
I mean, why drive to Tucson or Phoenix, especially if you're not feeling well? Why would you want to do a 3-hour trip or a 6-hour round trip? Yeah. So I say definitely check. What's a good way for them to find out whether or not you offer the service
Absolutely.
here?
So you can reach us. You can reach out to the main number. We have operators standing by. That can take that call. But there are associates that are part of the team, and they can help. And also, you can call the main number of Sierra Vista Medical Group. That's where our employee providers are. That's where they do their clinic, and they have a full listing of services. And we'll be at the health fair this weekend, so we'll be sharing that information there as well.
Wonderful.
Our website has our
And our website, yes.
Our
And the
website
website.
does have
And
our
what is the
services.
website? We know off the top of our head.
CanyonVistaMedicalCenter.org. .com. It is .com.
I just have this Rolodex in my brain. I don't visit our site.
So we'll say that again, CanyonVistaMedicalCenter.com.
Or you can go to Google and type in Canyon Vista Medical Center, and it'll take you right there.
It'll come right up.
The magic of Google always
That's right.
works.
That's right. Absolutely. Well, we're going to get on to our events in just a second here, but I just want to say congratulations. This is a huge success.
Thank
We're
you.
so proud. We're proud to have Canyon Vista Medical Center as a silver corporate member of the chamber as well. I've been a member of the chamber for many, many, many years. And so we're so happy. And so that just takes us to our upcoming event this weekend. So
Absolutely.
it's our Home Health and Business Expo this weekend at the mall at Sierra Vista. And we're super excited about that. We are sold out, by the way.
Awesome.
So
Very
so it's going to
wonderful.
be, so come out to the mall on Saturday from 10 to 3. And we have a lot of different types of vendors out there. But of course, Canyon Vista Medical Center is going to be there. They're going to have a booth. They're going to be doing blood pressure checks, correct?
Absolutely.
At the booth. So for all of you folks out there that should be getting your blood pressure checked, you should stop by the mall and get your blood pressure. So it's 10 to 3. So this weekend on Saturday out at the mall. And of course, our expo sponsors, our diamond sponsor is SSVEC, silver sponsor, Canyon Vista Medical Center. Copper sponsor is United Healthcare Medicare Solutions, and our media sponsor is Herald Review Media. And if you're interested in who's going to be there this weekend, make sure you get your paper on Wednesday or log into the Herald on Wednesday. We're going to have a nice 4-page spread, and it's going to have the layout and where everybody is. And that is to be determined right now. I'm still working on that. But it's going to be in the paper, so you'll be able to see who all those vendors are and where they're going to be located at the mall. So you make sure and find Canyon Vista's booth and go over there and get your blood pressure taken and get some information. So we also have that morning the Shred-a-thon in the parking lot. So drive-through event, $5 a boxer bag. We'll be out there starting at 8 a.m. this time. So 8 to noon or until the truck is full. So the truck has dragons on the side, and they tell us that when the dragons look pregnant, can't put any more in there. So, and it does, it bulges. It's kind of funny. So, so anyway, that is 8 a.m. to noon in the parking lot at the mall over by Sears, where Sears used to be. $5 a boxer bag, cash, please. And please remove all binders and clips before you drive through. And have to thank our exclusive sponsor for our Shred-a-thons, which is Guild Mortgage. All right. So moving on. Oh, we have one other thing. Oh, tonight. Don't forget, tonight is Business at Twilight. So 5 o'clock tonight, 5 to 7 at the Herald Review Media Building. So they are hosting this time, and make sure you register online at svachamber.com. That way they know how many people are coming, because they do feed us. So, and we want enough food. We don't want to run out. So, so anyway, moving on, we have a ribbon cutting coming up. That is August 22nd at 4 o'clock, and is Advanced IT Concepts Inc. And so they've got a building over on Arden Avenue, close to where Tombstone Brewery is going up, very close. But they have a ribbon cutting coming up. Again, that's August 22nd at 4 o'clock. The building is fabulous. So they've done some incredible renovations. So please make sure you come out for that. But please RSVP on our chamber page before. We need to let them know how many people are coming as well. So just RSVP at svachamber.com. And now we have some save the dates, because September, that sounds like a long ways away, right? Yeah, no. So September 9th at 5:30, we have our candidate meet and greet. So we have a lot of candidates coming here to Sierra Vista, and that gives our communities, Cochise County, a chance to come and meet some of these candidates. It's a free event. It's at Cochise College, the Student Union here in Sierra Vista at 5:30. So that's September 9th. Put that on your calendar. And that one is sponsored by American Southwest Credit Union. September 13th, Good Morning Sierra Vista. So we're a little busy in September, okay? September 13th is Good Morning Sierra Vista. So our guest speaker for that one is Jason Bowling, the CEO of Sulphur Springs Valley Electric Cooperative. And it is sponsored by them this time as well. But registration is open for that. So please make sure you jump on svachamber.com and get registered for that in advance. And then September 21st, we have City Council Forum and Mayoral Debate. Yeah, that's going to be at the Klein Center for Performing Arts over at the high school. And that one is sponsored by KE&G. It is free and open to the public. It'll start at 5:30, but we'll have a new mayor come January. So first time in 12 years. So this gives our community the opportunity to go out and learn about our candidates and be informed before you go to the polls. That's the plan.
That's it.
Yep. So, and that one is sponsored by KE&G. And then September 24th, for all you golfers out there, it's our second annual golf scramble. Registration is open for that as well. Absolutely. So make sure you jump on and get registered for that. We had a lot of fun last year. We're going to have more fun this year. That one's sponsored by SSVEC and Herald Review Media. And don't forget to take your business online. If you need to know how, let us know. There's a form on our website for Take Your Business Online. Just fill that out and we'll get you all enrolled. Free program. And sponsorships. If you want to sponsor something, you're a chamber member, you can just go to our online store. It's all on our website. And if that's too hard to get to your laptop or your computer, download everything on our app is on your phone. I'm good at this. Yep. So download the app onto your phone and everything will be at your fingertips. And that is all we have for today. Again, congratulations. So proud of our local hospital here.
Thank you for being
Yes.
here.
And good job. Good job. I mean, to go from a 1 to a 4 in 5 years, that's incredible.
And on our way to 5.
On the way to 5. That's right. All right. Thank you very much. We are the Sierra Vista Area Chamber of Commerce, your chamber.